Singleton, will you lead us in prayer, sir?
Good morning, everybody. If you would, join me for a word of prayer. Our Heavenly Father, we thank you for this beautiful morning. We thank you for the rain that comes and replenishes everything for us, and now we thank you for the dry weather. Lord, we just thank you for so many blessings here in Montgomery County. Lord, to ask you to continue to be a part of Montgomery County and don't let us ever try to push you aside. Lord, just ask you today that you kind of push me away today and that you'll help me make decisions that's going to be the best interest of our entire county. Thank you for our employees and the hard work they do, and thank you for this county commission. In Jesus' name I pray. Amen.
Good morning. We will go over our scheduled attendees. First, we will hear from City County Emergency Management Agency. Next, we will hear from Sheriff Derek Cunningham, who will be joined by Architect Patrick Addison from PH&J, Finance Director Cheryl Thomas, County Engineer George Speak, Director of Risk Management Holly Leverett, Parks and Recreation Director James Williams. Our Manager of Public Affairs, Hannah Hawk, will not be here. She is sick. Executive Director Miles Mabry with the ASU Center for Leadership and Public Policy, and Ms. Barbara Mays with SOAR Educational Village. We will hear from Christy.
I said, well, at least the water slowed down. About 18 inches of it. I said, well, she had 18 inches.
Good morning, everyone. So our updated COVID confirmed cases is 26,172. We have experienced 627 deaths of those people. Since yesterday, when I sent out your notification email and your updated COVID situation report, we've had an additional 53 COVID cases in our county. We're starting to see the same escalation we saw prior to the Christmas holidays last year.
Oh, Jesus Christ.
For the East Central District, which is the 11 counties that the health department supports that we're included in, there are 53 Delta cases as well. So that's where we're starting to see that uptick, and we're wanting to make sure that you're aware we are still in the high threat for escalating cases. We do have a vaccine event this Thursday. We're partnering with Alabama Department of Public Health and East Del Mall for a back-to-school event. We'll be out there from 3 to 6 this Thursday. And far as our vaccination efforts, we've had 90,753 people take at least their first dose of the COVID vaccine. That brings us to 40.07% of our county population. We've had 68,758 people, or 30.36%, that have completed their vaccination series at this time. We have administered a total of 155,996 doses throughout the county. So last time we were here, we were charged with making sure that we were back into doing some mass vaccinations, and we did that this last weekend. We were able to vaccinate 238 people at the Garrett Coliseum, thanks to that partnership with the Montgomery Kiwanis Club and the Alabama National Fair. Of that 238 people, 115 of them were our students aged 12 to 17. As far as our vaccine efforts also go, 40,000 doses have been to our African American population in Montgomery County, bringing us to 44.05% of our African American population has received at least one dose. 28,300 of those vaccines for our Caucasian population, bringing the total of 31.23% of our Caucasian population has been vaccinated. We've had 52,100 of our females, 38,000 of our males. And the breakdown into the age groups, our 0 to 17 has received 4,100 vaccines, 18 to 29 has received 10,200, 30 to 49 is 24,100. Our age group of 50 to 64 has had 25,600. 65 to 74 is 16.1 thousand, and 75 and older has received 10,700 of our vaccine doses. Any questions? Thank you very much. We're asking to go ahead and leave. We've got to go out to East Montgomery. There were some homes that were damaged due to the flash flooding yesterday, and we're going to go out and do damage assessments. So thank you so much for your time.
One question, do you have a supply mask? You still have masks?
No, sir. The masks that we have are very limited. We have made requests through the WebEOC, through Ames and the Alabama Department of Public Health, and they are not providing us masks any longer. So what we have, we are trying our best to hold on to our public safety first responders. The Alabama Department of Public Health advised they are only supporting efforts in the hospitals now. Thank you.
Lauren, do we still have some?
We have a limited number. We're in the process of trying to acquire more.
Mr. Chair, I wrote it up, I think I can get you some masks at cost, if you want to. They're out.
Let's see how, what she's got to keep going. Okay.
Now we'll go over the items that will be discussed at the formal session. We will consider an alcohol license application for a Latino festival on August 7th and 28th. Consider amendment number 2 to a contract with Safeguard Pest Services for pest control services. Consider agreement with the Alabama Department of Transportation concerning funding for resurfacing Meriwether Road. Consider amendment number 2 to a contract with Liberty Disposal to add a dumpster at Elton N. Dean Senior Park. Consider amendment number 3 to a contract with Harrison and Associates for landscape maintenance at the industrial park. Consider an award of a request for proposal for inmate health care services contract to NAF Care for the detention facility and the youth detention facility. Consider board member appointments to the Montgomery City County Public Library Board. Consider miscellaneous appropriations to agencies. Are there any additions? Consider miscellaneous appropriations to education. Consider miscellaneous appropriations from designated revenue.
What item is that?
12.
12? What item, what number?
Item number 12 are miscellaneous appropriations from designated revenue. That's in the formal session.
Go ahead, go ahead. I'll catch up. Go ahead. Go ahead, Fawn.
Consider a budget change request number 2 for the youth facility detention. Consider unbudgeted position fill request for the engineering department. Consider position fill request for the detention facility for 3 corrections officer trainees. Consider position fill requests for the district attorney's office for a retired RSA employee and a legal support assistant. Consider a position fill request for the engineering department for a county road equipment operator 1. Consider a position fill request for the finance department for an account clerk. Consider position fill request for the probate judge's office for a customer service clerk, probate court clerk, and a retired RSA clerical semi-skilled position. Consider position fill requests for the youth facility court for 2 juvenile probation officers and 1 juvenile probation supervisor. Consider a position fill request for the youth facility detention for a juvenile detention officer. Consider travel training requests for the county commission, finance, risk management, and the youth facility court. We will hear from Sheriff Cunningham.
Good morning. Ooh, hello. Okay, yeah, good morning. You ready?
Yes, sir.
Okay. I think Florence handed you all out a brief update as to some renovation work that needs to be done at our jail, especially our J1, where we've been having major plumbing issues. And right now we're running on one chiller, which controls that jail as well as some of the courthouse that needs to be replaced, and which controls our HVAC, which is our air conditioner units, and you can see where the roof work needs to be done, and basically some really just cleaning up, but it's a large amount of money, and that's why you all had charged us to get with the architects to go and look at it, and PH&J is here with me, and I guess they can go more into the details as to what needs to be done. But as you can see from the work, and you can see from the water bill that we've been paying over in our J1 due to the copper pipes that are deteriorating that needs to be replaced, you can see that this is something that's much needed, and we're going to have to do it.
Hey, Sheriff, excuse me.
Yeah.
A question. I was just wondering, any of your colleagues across the country, are they looking at justice-involved individuals and trying to maybe look at a different approach as opposed to building more jails? Anybody doing anything innovative in terms of how we deal with nonviolent offenders as opposed to building more jails and spending a bunch of money trying to maintain them? Any thoughts on that?
Well, yeah, everybody's looking at now. You got a lot of different programs out there, but at the same time, our jail now is not full of inmates that will be on programs. These are the murderers and the violent criminals. We don't have too many county sentenced inmates over there. These are all people waiting to go to trial. I mean, so if you got over 100 people sitting there waiting to go to trial for murder, not to mention robbery and rape and all these other violent criminals, crimes, you know, there's not really too much you can do. But as far as on the renovation side, yeah, I know Baldwin County, just about everybody is trying to correct some of the issues that we have, because we built that jail in '86, and everything that's in there as far as the copper pipes are pretty much shattering. You fix this one, it break here. You fix it, break here. So they've just integrated their jail and went in and replaced it with Plex. I think PH&J is doing that job as well, and putting in tankless water heaters and things of this nature, trying to cut down on some of that cost instead of going in with a big chiller. So, but there's a lot of things that we can look at and a lot of things that we can look at doing, but either we fix it now or we're going to be forced to fix it later. So I'm bringing it to you all now and letting you know this is something that needs to be repaired. It's going to have to be repaired. Not only this is just a small touch right here. We ain't even talked about the cell issues with some of your locking mechanisms and things of this nature. So,
Thank you, sir.
Patrick, how old is that building?
The building is approximately 35 years old.
35 years old, okay. So this that we have, has it been prioritized that everything is a priority?
Yes, sir. The county went through a kind of a 10-year plan and determined which of the systems that they needed us to look at and provide budgeting. And one of the biggest issues was the plumbing issue there in the jail. It's not unique to Montgomery County. We're working with about 3 other counties right now replacing the piping. Roughly, the copper pipe that was put in buildings from about 85 to about 95, the alloy that they used is vulnerable to some of the hard water conditions, and it's literally eating up the pipes from the inside out, and they're about as brittle as you can be. We've gone into some situations, and within about a 5-foot piece of pipe, we had over 40 water leaks. So what we're doing now is getting rid of all the copper and going in with a commercial PEX product, which eliminates this type of corrosion and and vulnerability to water and even some of the additives that the water companies are adding to the water to keep the water safe for us.
Sheriff, who we housing that, this is the old jail, right?
Yes, sir. Yeah, this is in J1.
Who are we housing in there now?
Most of them are all violent offenders in J1.
About how many of them?
Whew. Right now, this morning, we had 600,
Just in that part, though,
just in J1.
just across the street, in the old jail.
Old jail right now, we probably got about 270, 290.
That many?
Mm. Yes, sir.
And the other side is full, the new side?
No, not the new side. We still have cells available on the new side.
Yeah.
Our problem is that when we go in and start doing this, we got to shift everybody. And so we got to have one whole side, one wing, so that when they start the ceiling, the top floor, they got to go all the way down to the bottom floor. So we're trying to really get this done while we have the space to be able to move people around.
Mr. Chairman, I know it's something that needs to be done, but I just got it today, and
Oh, yeah.
quite frankly, I can't even read this.
Yeah. And like I said, you went over to the old jail with me.
Yeah, I've seen
Yeah,
it.
and that was the old jail. And I was showing you the renovations that we had done on those 2 floors, and we went up to the other 2 floors, so,
This is the same building, right?
same building.
Yeah. I understand the work needs to be done. We need to look at it, though, because this is a big bill. Is it part of our plan already?
Parts of it are included in the 10-year plan. It's just some things are needing to be accelerated.
The other thing is that, we don't have what we call a preventive maintenance plan. We just got, we supposed to be professional people. And, priorities, I ain't no way in the world I would have raised my hand to do that courthouse, and we needed to do 26 million in the jail. The jail makes us money, the courthouse not making us any money. So we want a luxury courthouse, but we got jail, pipes and stuff leaking. So we got to establish a preventive maintenance. It's got to be ongoing and precise. We got to have it.
And I agree with you on that. But right now, we got 2 maintenance personnel that's working the jail. That's all day long, just changing light bulbs and changing out things that's been broke. Also, we've been working with Patrick and on new sprinkler heads. Every time somebody busts a sprinkler head, you're looking at how much money we're spending on that too. So we're in the process of every time one's broke, we change it out to pretty much a sprinkler head that you can't really tear up like the ones they've been tearing up. So there's a lot that we need to be doing, and as you said, on the preventive maintenance side, but when you're running into a water bill that's, you know, $26,000 a month, that says a lot. So we really need to go ahead and at least try to get this issue resolved on the plumbing.
Mr. Chairman, I thought Lamar was supposedly heading up some of the things that you talked about as far as preventive maintenance is concerned. Is he not here today?
Yeah, he's up there, but we still haven't got preventive maintenance.
I thought that was something that was part of his responsibility, unless I'm mistaken.
Also, while I'm talking to you all, on another note that we're working on, myself and Holly, is on the accreditation process. And we just got the paperwork in Friday to go ahead and move forward with that. And so really, Mr. Chairman, I would like for you to go ahead and sign that so we can go ahead and start getting this accreditation process moving forward. Because I think, when we got to start on the 14th, and we won't meet again before then, so. On the 13th, yeah. So I think you have all the paperwork? Yeah. So if we can get you that paperwork so we can get it signed off so we can start moving in that direction on the accreditation side for our medical.
Okay.
So that would be that the commission would agree to participate in this study.
Yes, in the Harvard study.
Is that all right with the commission?
Mr. Chairman,
Yes,
I just have a question. I want clarification on accreditation. What, can you help me with that, Sheriff? What are we talking about?
Well, this is accrediting that the medical facility that we're running inside of our jail meets the standards so that our inmates are getting the best medical care that's out there. And that's what this accreditation process does. Oh, she brought me some pointers, and I ain't got no glasses on, but I'm gonna try it. Yeah, because you got it on 10.
So the accreditation is going to offer, these are some points it'll do. It'll give us an independent outside evaluation of our healthcare facilities inside the jail. So we'll have an actual report they'll come in and do. It also sends physicians to every site visit to kind of look over our medical records, make sure things, it's kind of like an audit, just to make sure we are handling things in the way that our healthcare providers should be handling them. So it's a check on them and us to make sure that it's being done right. They say attorneys and patients are citing a lack of accreditation for signs of poor quality of healthcare in the jail. Also, judges are ruling as corrective action in some cases that accreditation be part of that corrective action. And there are only about 500 counties nationwide who are accredited. So this would put us a little bit of a higher level of esteem for our peers.
Holly, would you clarify who does the accreditation?
Yeah, the accreditation is actually done by the National Commission on Correctional Health Care. They are the leading inmate health care commission in the country, and one of their board members also is now the president of the healthcare company that we just agree, or we're going to agree to today on the agenda, NAFCare.
NAFCare. Now, in terms of vetting, I know you've done a great job of vetting, but I was just wondering, in terms of the legal issues that these medical correctional providers have, does any of that weigh into the decision making when we decide who we're going to use? Because I know looking at NAFCare, they had quite a few legal issues.
Yeah.
You know, some of them perhaps were allegations. Well, I guess all of them was allegation until proven otherwise. But I was
Right.
just wondering about the legal issues. I know
They all were vetted. That was one of the questions in the RFP. They all had to provide any open and closed legal issues that they had going on. One issue was just settled through NAFCare. Recently, it was a settlement that was kind of publicized in the Alabama.com, and they were able to tell me exactly what happened. They actually self-reported something that was, so the settlement ended up being a settlement based on, most of it was just restitution of what they feel like they overpaid. Through an audit process, it brought to light something they felt like they overpaid. But yes, that was taken into consideration with all the companies. I didn't need to take over for you.
No. So, Mr. Chairman, we would ask that you all go ahead and approve that accreditation so we can get started on that process too.
Okay.
I do appreciate it. Any other thing?
National Night Out tonight?
Oh, yeah. Well, yeah. We're going to be at Home Depot from 5 to 8, so I'm asking everybody, y'all, come on out. We're going to have a great time out there. It's a party with a purpose. We're talking about crime prevention, so come on out. We got a lot of different public safety entities will be there, us, the city fire, Pike Road Fire, and thanks to Doug and the town of Pike Road, we're going to be giving out awards to the neighborhood association that brings the most participants to come through and sign up. So we got a first prize will be a $400 gift card to Home Depot. We got a $200 gift cards to Home Depot for second, and third we got a $150 gift card for the neighborhood association that brings the most participants through and sign up. So come on out. We're going to be having little chicken wings, french fries, hot dogs, and popcorn. So come on out. We plan on having a great time.
Sheriff, let's go back to
Okay.
this renovation sheet. Team members, we need to, I guess we need to look over what kind of action we need to take, when, because if we let it be prolonged, it's gonna get worse, so we need to discuss this somewhat, and then have some concerns.
Yeah, I just got it there.
I know,
I'm
yeah, I do too.
gonna sit down with Florence and the sheriff.
Yeah. And like I said, feel more than welcome. Y'all want to go over and look, I'll take you over and we'll go look. But I think you really need to see the leaks, and you need to see what needs to be done. Especially with us running on one chiller. You see what happened over in our building. All it takes is the air conditioning go down once or twice, and you know, the whole building shut down. So we got to be mindful about that, running off of one chiller.
I think I've seen some of that, Sheriff. We're gonna make sure that copper doesn't get away, right?
That what now?
That copper, we're gonna make sure that doesn't get away.
Oh, that's going to be on Patrick now.
It belongs to us, right? We're
Yeah,
gonna-
yeah.
You know, the next thing would be for the architects to proceed with construction documents, and, you know, after conversation, there could be discussions about what might be alternates and that sort of thing.
Send this to me electronically,
Okay.
that way I can blow it up. Having trouble seeing.
Okay. Thank you.
All right, thank y'all.
Next, we'll hear from Cheryl Thomas regarding item number 10.
Good morning. You have the document. This basically is a request, or personnel did a study of 2 of my positions, and they have recommended that the payroll benefits manager be upgraded to a pay scale, pay grade A8 from A6. It's well past due and deserving, and I hope you will put that on the next agenda and approve it.
Okay. Next agenda? Okay.
Thanks.
George Speak, items 1, 2, and 9.
Okay, this future agenda item number 1, that's our annual transportation plan that's required under the Rebuild Alabama Act for FY '22. And this is about 23 miles of road, a little over 2 million. It's at Pettus Road, Sprott Drive, Edna Brake Lucas Drive, Old Cardiel Road, and Old Pike Road. And we'd ask that y'all approve that. After it's approved, then we post it, and we also send it to ACCA.
Next agenda?
Okay, future agenda item number 2. And that's a letter agreement between the city and county concerning resurfacing Wasden Road and Lamar Road. And we had MPO funds set up to do the county part, and we started on the plans, and then the city approached us asking, they also had some MPO funds set up for the parts in the city, and they asked us if we would consider putting it all in one project, and the city paid the part that's in the city limits, and the county paid for their part that's out of the city limits, which that would be fine with us if they want to do it like that.
Tomorrow is not in the county.
Yes, sir, parts of Lamar, parts of both those. Let me see.
I know Wasden, but Lamar,
Yeah, on what?
Lamar runs from 80 to Wasden Road.
Right. Let's see. Wasden Road is about a mile in the city, and there's about roughly 3 miles in the county.
Rotten Road runs on into Haven.
It goes all the way to the county line, right. And let's see, Lamar Road is about 2 miles in the city and about a mile is in the county. But the city's paying for their part, we're paying for our part. And we have no objection to working it like that, but if y'all don't want, it'd be up to y'all.
Next agenda.
Then let's see, on the personnel action items, the personnel department, they reviewed our master auto mechanic positions at both the city and the county. Have that same position, so they reviewed it for the city and the county. And they recommended upgrading it from a pay grade S to an S11, which we think is very much needed to be more competitive trying to recruit and retain people. So we recommend an approval of that.
Okay. Next agenda.
And let's see, the last thing, the Meriwether Road project, it was in the state letting last Friday. And low bidder was Mid-South Paving. Low bid was $634,000, which it was well within the budget and should start around September, sometime start work. And that's about all we got. Thank you.
Holly?
So I've got future agenda items 3, 4, and 5. They all pertain to our renewals of our, some of our health insurance contracts. Number 3 is our contract with Alliance Insurance Group for our administration of our flexible spending and our HRA monies. So there are no changes to that this year. Everything's remaining the same.
Next agenda.
Okay, and then item number 4 is on our Blue Cross Blue Shield renewal for the administrative contract and the plan itself. We are not making any changes to that plan this year, and we were able to negotiate last year a 2-year administration fee agreement, so we are in the 2nd year of that. So there won't be administrative increases this year. Our plan looks to be moving flat for next year, our spend, but a lot of that is based on a year where there were very few elective surgeries because pre-COVID, all those elective surgeries stopped right as COVID hit. So it's kind of, it's hard to really project based on last year because there was not a lot of healthcare going on in the hospitals due to surgeries. Trying to think, so that, before I move into that, so those that's the Blue Cross Blue Shield renewal agreement, pretty much staying the same as well. So that will have to be approved.
There's no change on that, right?
Huh?
No change, right?
No change on the benefits side. We are looking, and that moves us to future agenda item number 5, we are looking at increasing premiums.
Oh, yeah, I mean, that's the one.
So on the benefit side for 4, no, we are not, there are no plan changes, there are no administrative cost increases.
Okay.
So that can go to the next agenda.
Yes, ma'am.
So number 5, this is where we get into looking at evaluating the cost that our employees pay. I put in your packet, I had done a benefit plan comparison with other counties and cities in our area. So that's in your packet, and as you can see, We are substantially lower than most areas in other localities in our area. That is a huge benefit for us. It should be a selling point for our employees to help them want to come here and want to stay. But so I just wanted you to have that for your information.
Now, I noticed the over 65 would not be affected by the increase?
That is correct, and that is because when they get on a over 65 plan, we ask them to take Medicare's Part A and B, which makes us secondary to Medicare. So our spend for our over 65s is much less than our other groups.
So what's, I noticed you have, you don't have the rates, the current rates for over 65 individual.
I would have to get those because I didn't think to put them in here because we weren't discussing those, but there, I can get you those.
Be interested in that because I think most of the complaints that I get is from over 65ers.
And their rates are considerably lower than these.
Well,
I mean, I want to
know
say
it's
single,
over-
maybe $42 a month.
Well, you got one rate down here, over 65 spouse, $230 a month.
Those are for the surviving spouses. So once an employee passes away, we allow the spouse to continue under our plans. So those are just for the surviving spouses, so they were never an employee of ours. We just agree to continue covering them. We have very few of those. So we're looking at an increase of $18 a month, which would be $9 a pay period. And as you can see, just to give you City of Montgomery numbers for individual, we are, even with the $18 increase, we would be $128 less a month for individual and $176 less a month for families. That's just us based on comparing us to the City of Montgomery. For Jefferson County, we would be $84 less for individuals a month and $187 less a month for families.
Oh, it's still a bargain. Just hope it didn't cut into the raise too much.
$9 a pay period.
The only one that we are more than would be Mobile County, and that is because they are covered under the local gov health insurance, which is not as rich a plan. Basically, that means that they pay more out of pocket when they go to the doctor. Once on our PPO plan, once you meet your deductible, our plan pays 100%, and that is almost not heard of anymore. Most plans have a 90 or 80% that they'll cover after the deductible.
What a maximum out of pocket?
What now? I couldn't hear
What
you.
a maximum out of pocket after that?
Maximum
Then
out
they
of
pay
pocket, I think, is $3,000 and $6,000
Then
a
they pay
year.
100.
So it's still relatively low amounts for out-of-pockets, which that is also kind of unheard of nowadays. Most of those out-of-pockets are higher.
All right.
Any questions?
Applaud what you do for us.
Thank you.
And so that will go to the next agenda.
And this is, we should note, this is the first increase since
2017 was our last increase, and over the course of the last 3 years, the commission, we have had increases, but the commission has absorbed those increases, so we have not passed those on to the employees. Okay, thank you.
Thank you.
James Williams.
Good morning.
Item number 6.
I come before you today asking for approval to move forward on the Tire Marketing Fund grant application, which is funded through the Alabama Department of Environmental Management. This is scrap tires, which will be utilized at the Snowdoun Park Playground for rubber mulch. It's funded through a $1 fee on all replacement of tires. And the benefits of this will be, this is a softer material than the wood chips, which we're using right now. Also, from a maintenance standpoint, the rubber mulch won't decay. And also, material-wise, the fall zone for the rubber mulch will be roughly 6 inches versus the wood chips is 10 to 12 on the fall zone at the playground. Cost will be roughly a little over $13,000, with the county only covering the freight costs of $1,634. So I'm asking to move forward for this grant. It's a non-competitive grant, and we'll use this as a trial run and may use it in the future at other park sites. Any questions?
All we have to pay for is the freight, right?
Freight costs only, and the removal of the
It works good.
existing.
We've had, I've
You've got
seen
it.
before, it works good.
Right.
Okay. If there's no objection, we'll go to the next agenda.
All right, thank you.
Hannah was our next scheduled visitor. She's not here today. She had prepared for you a calendar of upcoming events. You'll see that we've got a few more activities going on.
Did everybody get this?
We got it.
Tonight is our Montgomery County Sheriff's Office and National Night Out. Holly had also prepared a schedule for all the National Night Out activities, and there should be one at your place if you want to participate in the different activities. The sheriff will be at the parking lot of Home Depot from 5 to 8 this evening. In the morning at 9 o'clock is a tour of the new Mental Health Crisis Diversion Center on Carmichael Road. I believe that's on the sign-up sheet if you want to tour the new facility that's been made possible through the statewide grant of about, I believe, $6 million. Another item to note is Friday is the last day to cancel your ACCA convention reservations. If you've signed up and don't plan to attend, please let Loretta know and she can cancel that reservation or that registration. Any questions about those items? Next, we'll hear from Executive Director Miles Mabry with ASU Center for Leadership and Public Policy.
Good morning. Normally, I would have been here in March. The federal law requires that after a 10-year census that the numbers be published in March, and then all public political divisions have to be redrawn to fit the population. For instance, if there was 100,000 people in Montgomery County, there would need to be 20,000 people, not voters, but people in each one of your commission districts. So where we are today is that they're telling us, we're a state Census Bureau data center, associates data center, and they're telling us that the numbers are going to be released next week. Now, there is a federal suit going on that could change that, but if they release the numbers next week, our software vendor that helps us do all this tells us that they can have, within 10 working days, they can have us the data so that we can give you the data so that you can see what the differences are in your different areas. And I just realized when I was looking through the files that we have 3 new commissioners that were not here when we went through this process the last time. Am I correct? Yeah. Okay.
Now you got 4.
Maybe.
Yeah, we've got
Oh,
4.
4?
We would have
4
4.
new.
Okay.
I
I thought you were here.
No.
Okay.
Only Elton was here.
Yeah.
Bring the mic up closer.
Oh, okay.
See if they can hear you.
Yeah.
Only the chairman was here.
Oh, okay, all right. Well, anyway, the process works like this. I've got a sheet that's from the previous thing that I'm going to have Lewis Hines, our reapportionment person, hand out. He's giving you a card from both of us and a sheet that shows you what we did 10 years ago. And the first thing that happens is that top part of that sheet is the numbers that come from the Census Bureau, so that we see what has to be adjusted and what districts have to be adjusted. And then normally what happens is that we would meet, we'll print out maps, we'll print out this data for you, and then we individually meet with each one of the commissioners and give them an opportunity to tell us where they would like to see adjustments made. And then we meet with contiguous commissioners, so that 2 at a time, you're working on the lines so that you are in agreement with what's being moved and what's staying the same. Let's see. The pandemic, of course, delayed everything, so we're hoping that by the end of the month, you'll have these numbers and you can see exactly what's going to need to take place. Okay. After we've gone through the process of getting it all back to where the numbers are equal, actually, the courts have still backed the fact that you can have a 5% deviation. So in other words, going back to my example, if it was 20,000, you could either have 19 or you could have 21. So there's a 5% plus or minus that's a deviation that's allowed by the courts, and that's still been supported today. Same numbers we had in 2010. And then what happens is, once we've got a plan drawn up, we'll want to have a public hearing. We'll support you in printing maps to go into public places so that people will know. You'll have the public hearing. If there's any changes or anything that needs to be adjusted, we'll do that. And then what will happen is you'll adopt the new plan, and then it goes to the Board of Registrars. Now, the timing of all this is real important, because in the past, see, we would have been doing this in March, and that would have given the Board of Registrars a whole year to move people that are going to have to be moved in this process. Unfortunately, see, we're coming up in 2022. You've got a primary coming in June, or is it March? June, I think. Anyway, they're not going to have the time that they had to get these people moved. So we've worked through a process that we think we can use a computer to identify the people that would be involved in this and help them get a better handle on who needs to be moved and where they need to be moved to or from. What I'm told by the Secretary of State's office is that they're expecting to have a special session. In that special session, they're talking about moving the primary back maybe 30 to 90 days. I've not seen anything to back that up, but that's what I'm being told, is that in the special session, because a one-time thing, because their data isn't getting to the boards of registrars late, that they need to have that time to get the people moved. Law requires them to notify the voters 90 days prior to an election of any changes to their voter, where they vote or what district they're in. So, you know, if you put the 90 days to where we are now, they're going to be really, really pushed to try to get all this stuff done. So if the legislature will give them some relief, that would be fine. Either way, we're going to do whatever we can to support them, and we appreciate the fact that y'all are allowing us to once again be a part of this. Just so you know, we've since moved. We were at 600 South Court Street the last time we did this. We're now at 32 Commerce. We have a new reapportionment lab there, new plotter. Since you hadn't been through this before, there used to be the thing that drug along was printing those maps. We have a new plotter that prints maps faster. And then we also have the capability now of being mobile. We can put the software on a laptop, and Lewis can come wherever you want us to come, set it up. We have a projector. And then you can do the work. You don't have to be in our office. You can be here or wherever you want to be, and we can work with you mobily. What else? Let's see. All right. One of the things, the reason we're here today is that we've sent you a copy of a contract to put in place to carry out all this. If you look at the contract, you'll see that there's been no change in the amount of the contract from the previous 10 years. And if you go back and look, you'll see that we didn't even spend that money 10 years ago. So one of the things that the reason the Center's involved in this is because as a part of our SACS goals for the university is that we do outreach to our community. And the county commission is a part of our community. So we're here not to make money, but to help you do what you need to do at the least cost that we can possibly provide it for you. Anybody, any questions?
Next agenda, Mr. Chairman.
Yes, sir.
All right, thank you.
Thank you, Mark.
Item number 8 on your information session agenda is the Levitate Legal and Consulting Contract for Services regarding the ARP, American Rescue Plan Act of 2021.
Is the city acting on that today? You know, is it on their agenda? Anybody know?
I do not know for sure. We've had conversations with Betty Beeville and Chip Hill, and it was my understanding that they plan to consider it today, but I'm not certain. Over the weekend, we made a few changes, which is updated in this particular document, adding some more compliance issues regarding the federal guidelines, but it's my understanding that it's a go for them, but I do not know that they are officially taking action today.
The only question I had, and it's not an objection, it's just a question, and I don't know if it was just in there because it's standard, but automatic renewals. I mean, that provision, was that something negotiated?
It was just part of what they had presented. I don't think we had discussed it in advance.
Did anybody else notice that?
I don't think we accepted. We wasn't supposed to accept that piece.
What part of that? Excuse me, Dan, what you talking about?
It was automatic renewals. The contract automatic renewals.
Unless we act.
Unless we, give them notice or something within 12 months. I think we got a 30-day notice. We'd have to let them know something that within 30 days of the year passing, is the way I understood it.
So, nobody have a problem with that?
Okay, so can we put it on the next agenda?
Yes.
Okay.
Our final visitor is Barbara Mays with SOAR Educational Village.
Good morning. Good morning. And thank you for giving me the opportunity to be here this morning. We're here again, and let's see. We were here a few weeks ago to talk about crime in this community, and we're here again today to talk about crime in this community, as well as a couple of other projects that we have taken on because they were brought to our attention by citizens of the city of Montgomery. I want to tell you, first of all, and invite you to a meeting that is going to be a community-wide meeting that will take place on Thursday, the 12th of August at 6 p.m. at Weeping Willow Baptist Church. And this meeting is created or designed to address some of the concerns that citizens of the county and the city of Montgomery have that they need the county's support on, as well as the city's support on. And many of these are families who've been coming before the city and the county for years asking for your help, and now it's time that we take a serious look at what they're asking for and how we can make it happen, particularly since we now have many funds coming from various sources that can help the folks to get their issue taken care of. SOAR Educational Village is an initiative that was started by several people in the community. We say that we are successful, outcomes-driven, as well as achieving outcomes and reaching goals. Our moment of justice is now, and it's also our moment in time to make a difference in the lives of people in Montgomery, Alabama. We are a one-stop 501c advocacy organization. We have a 5-member board of directors. We are an advocacy organization that assists people through both Montgomery County and Montgomery City. So we're not just limited to the city of Montgomery. And many of those that we assist have expressed concerns. And this is not to throw shade on anybody, but when a person tells me I've called an elected official, or I've called a particular office, or I've left a question on someone's voicemail, and they don't even have the courtesy to call me back, that is a problem. And if it's not a problem for you, it should be. Because the people in Montgomery City and Montgomery County pay your salaries and pay to keep this city going. to make a long-term impact also on the quality of life of residents in our community. And we all talk about the quality of life, but how often do we make a commitment to do something to change that quality of life, the same ones that we want for ourselves and for our families? And we support the CDC's position that youth violence is a significant public health problem that affects thousands of youth across this country each day, and it turns their families it affects also their families in schools and communities. And we all stand to talk about it, but what are we doing about it? The good news is that youth violence is preventable, and the ultimate goal is to stop youth violence before it actually starts. And we all have a responsibility to do that. We advocate that by addressing root causes of issues in our community and working towards resolution rather than waiting and becoming reactive to a situation that has happened. We address many of the motivators of those crimes and those issues that happened many years ago, oftentimes, that young people are dealing with. We want to take a bandage and put it on a cancer and send that person away and expect them to be able to move forward to the next level or the next step in their lives. And it doesn't happen that way. They're still dealing with these things. You know, the young lady, probably one of the greatest athletes in the world, Simone Biles, is dealing with emotional issues that she's still not able to successfully compete as she has in the past. And if it's happening to her, can you imagine how it happens from a poor kid who lives in a certain area of Montgomery City or Montgomery County? We found that oftentimes people are sent places and directed and referred to other people, and they don't even take the time to call them back or to at least give them the right information. And I personally have called some agencies and been directed to the wrong person or the wrong information. The biggest problem we found, one of them, is youth having access to guns. And they're not just going out buying these guns. We know they're coming across these guns from various methods that are not always good and healthy. Irresponsible gun owners who fail to secure a gun in their car and leaving the car unlocked. We know that there's a 5-step program that helps young African Americans open up and talk about what those issues are. And we've got to not be afraid to say the word black or white or African American. It is a problem. And as I said in the last time I stood before you, if we are 90% of the problem, then 90% of the answer should come from people who look like me. And we speak with confidence because that is a program I have presented throughout this community to young people. It's okay to speak correctly. It's okay to stand and express your confidence. That sets you up for a better path in the future. We also work with various governmental departments to correct systems that don't work by re-examining some things that we've just allowed to happen as tradition from year to year to year. I have a young man who's working with the Tuskegee Red Tailsmen and the National Guard 187 regarding getting these youth involved in their programs, youth from the Montgomery community. We have partnerships with lots of local churches. The last time I was here, before I could get to the elevator, my phone was ringing from some young folks and people throughout the community who had heard or seen me on the internet when I was doing the presentation and wanted me to come again to ask you guys to help us, to help ourselves, to help our community. It's not going to happen unless you all say yes. We work with local businesses and encourage them to also attend this meeting on August 12th at Weeping Willow Baptist Church. The Montgomery County Sheriff's Office, Mr. Cunningham, well, Sheriff Cunningham and I have known one another for many, many years, and we've had this conversation just like I have with many of you over and over and over again. We continue to re-identify the problem. What are the solutions to those problems? I'm also working with the Alabama Conference of Black Mayors to make a difference in many counties across this state because we can do better. Mental health authorities, the governor's office. I have a meeting tomorrow with the Ms. Azzie Taylor in the district attorney's office. I met a week or so ago with the new police chief, Chief Harris here in Montgomery. I want this organization to partner with everybody who we feel can make a difference. Please help us to help our community. Individual contributions, donations, in kind, whatever you can do to help us to make a difference, feel free to. We welcome you. You can volunteer. You can tell others about the organization who are in need of in the community. We asked the city of Montgomery for $100,000 to help us to do this, and we're asking the county commission for $150,000 because we're serving a wider, greater area. And at the same time, we will have a letter of request along with our letter of declaration from the IRS declaring that we are a bona fide 501c3 in this community. We can have leadership training. We need that. Our young people need to know how to talk to people, how to speak with confidence, how to present themselves. And it's okay to say, I grew up in Greater, and I grew up not in Greater, but I grew up in Washington Park here in Montgomery. And I always say, and I'm not ashamed to say it, if a black woman who grew up as a little black girl on Hercules Street in Montgomery, Alabama, can do the things that I do, then anybody can. It is not difficult if you've got the desire and the passion to make a difference in folks' lives. That's what we ask you for. I will be doing a presentation for the National Park Service on a nationwide basis coming up in a few days. That will be at Alabama State University, that will deal with the civil rights movement here in Montgomery and the importance of communication during the civil rights movement. We've got to do a better job of talking to and with one another than talking at one another. So we're asking you for your financial support. We ask that if we don't do what we say we're going to do after you have funded us, then don't fund us again, because we know already what our track record is and what we have accomplished and what we will be accomplishing. Thank you very much for your time, and we're asking for your financial support for this community and for our young people, because if we don't do it now, this is our moment in time. And if we don't do it now, it is not going to happen. Thank you.
Mr. Chairman.
Yes, sir.
I have a question for Mrs. Mays.
Yes, sir.
First of all, do you actually have a budget, official budget? I'd like to see that.
I'd be happy to provide that.
And in terms of holding various agencies more accountable, in terms of addressing, carrying out the function for which they were established and addressing the needs of the citizen, do you have a plan? I mean, you did say that some of the agencies are not necessarily serving the citizens in an effective manner. Do you have a plan for how we might do better if indeed that is the case?
You know, I'm a trainer by profession, and what I've learned how to do is go in and look at a company's operation, and what we do is to make suggestions and recommendations how, by maybe changing this or changing that, you may get a different outcome. And that's all we're asking, is to be able to get a different outcome or to present a different outcome by doing some things differently from what we're doing them now. And if we're doing them one way now and that doesn't seem to be effective, let's try to find another way of doing the exact same thing and having a better outcome. So yes, sir, we do. Thank you all so much.
That's all our items and visitors.
Mr. Chairman,
Yes, sir.
I got a hold of the agenda for the city council. It may be on the next agenda, but it's not on this agenda, this week's agenda. The levitate deal, but then we don't get to vote on until next meeting. Anyway.
Right, yeah. Mhm. Yeah, okay. All right, what time is it? You need a break? Okay. Okay, that ends our information session. We'll go right into our formal session. The invocation will be by Commissioner Harris, and pledge will be by me.
Let's pray. Heavenly Father, we come first to say thank you